Hello everyone. Today we will discuss about OTC drugs. What are OTC drugs? OTC drugs are known as over-the-counter drugs. These are the drugs which are safe and effective for use for the general public without the doctor's prescription. Simply we can say you can go to any pharmacy and get these drugs without prescription. So it is also called as prescription decontrolled drugs. These drugs are the non-prescription or over-the-counter drugs. They have little significant pharmacological activity, and therefore the physician need not to be very much concerned about their use by the patient themselves. See, it has very little significant pharmacological activity. So that's why the physician is not that so concerned. It is used primarily for symptomatic relief and not as substitutes for the prescription drugs. Now let's see what are those significance. It is comparatively cheaper, an increased trend for self-care and increased tendency of patients to maintain their own health. Now the scenario has been changed. Patients are ready to go to a pharmacy just for cough and cold. They will take their own medicines. They are willing to maintain their own health. Then chemist himself may prescribe OTC. And these over-the-counter drugs considered as time-saving medications. Some patients do not want to spend much time in the physician's clinic. So at that time also, it is very helpful. We can directly go to the medical shop and we can get the medicines. Lesser number of side effects compared to the prescription medicine. So when we are comparing this OTC drugs with other drugs, other prescription drugs, it is very its side effect is very less. Now let's see. See, it's an interesting marketing analysis. OTC drugs are around 55% that are used by the Indians, but prescription drugs are just 45%. Now let's see what are the types of OTC medications: analgesics, antibiotics, cough suppressants, anti-acne drugs, NSAIDs, antiseptics, decongestants, antacids, antifungals, antihistamines, and smoking cessation drugs. First one is topical antibiotic. See, topical antibiotics are the medicines which are applied to the skin to kill bacteria, and they are used to treat or prevent infections that occur or on minor cuts, scratch, and bumps due to presence of bacteria. So it can be applied over the skin to kill the bacteria that are known as topical antibiotics. But cough suppressants, they are the medicines that prevent, of course, or stop the coughing. A cough suppressant is used for treating dry cough that are known as antitussives, and it helps to suppress the body's urge to cough. Then cough suppressants are different from cough expectorants. Cough expectorant helps in treating productive coughs that produce phlegm. See, there is two difference between cough suppressants and cough expectorants. If we take cough suppressants, what will happen? It will suppress our cough. But when in case of cough expectorants, it will induce the cough. So thereby we can spit out the sputum. In case of anti-acne drugs, which are used for this acne purpose, to get rid of acne, we use anti-acne drugs. And the problems include pimples, whitehead, blackheads, and other small acne related issues. Then non-steroidal anti-inflammatory drugs, that is nothing but NSAIDs. They are the medicines that are used to treat inflammation, mild to moderate pain, and fever. They are basically give with analgesic and antipyretic effects, and with higher doses, they have anti-inflammatory effects as well. Let's see what is antiseptics. Antiseptics are the drugs which are used to slow or stop the growth of germs and helps prevent infections in cut, cracks, and burns. Analgesics means nothing but which relieves pain. Decongestants are the drugs or the medicine which are used to relieve nasal congestion, which in common terms refers to stuffy nose, runny nose and all. Then antacids are the drugs which are used to neutralize the stomach acid. See, our HCl production will be more. To neutralize that, we will take antacid that will be buffer in nature, basic in nature. So it will neutralize this high acid production. Now let's see what is antihistamines. These are the drugs that are used to relieve or prevent the symptoms of allergy like hay fever, itchy eyes, sneezing, runny nose, and other kinds of allergy. Antifungal drugs are nothing but it is used to treat the infections which are caused by fungus. Smoking cessation drugs, which are the medicines that are used to help the people stop smoking cigarettes or using other forms of tobacco. Pain relievers, actually there are three types of pain relievers are used in OTC products. First one is salicylates, of which aspirin is most widely used. Then propionic acid derivatives, example ibuprofen, Menadol, Motrin, naproxen sodium, ketoprofen, and aminophenols, that is which only acetaminophen. Then Panadol, Tempra, then which are used as pain relievers. Then NSAIDs, the therapeutic effect of aspirin and propionic acid derivatives, also known as NSAIDs, that is non-steroidal anti-inflammatory drugs, results from the inhibition of prostaglandin synthesis. Prostaglandin is responsible for pain. Prostaglandins, which regulate many homeostatic processes produced locally at site of tissue injury, where delay sensitize nerve ending to painful stimuli and also produce inflammation. Antihistamines. Histamines is an inflammatory mediator that is associated with fatigue, itching, irritation of the nasal passages, sneezing, and the production of nasal mucus. They act by binding and stimulating histamine H1 receptors. That is H1 receptors found on the nerve endings. So H1 receptors are found on the nerve endings and thus antihistamines go and act on there and it will reduce the sneezing and nasal congestion and other allergies also. Antihistamines block these H1 receptors and preventing them from stimulating histamines. First generation antihistamines exert anticholinergic or serotonin effects as well as local anesthetic and sedative effects. Commonly used OTC antihistamines include diphenhydramine, bromopheneramines, chlorpheniramines. Decongestants, there are only one FDA approved decongestant, that is pseudoephedrine. Pseudoephedrine is an alpha-adrenergic agonist. It acts on adrenergic receptors in the blood vessel of nasal mucosa to produce vasoconstriction, resulting in decreased blood flow and shrinkage of tissue in nasal passage. See, let me explain how it acts. See, this FDA-approved pseudoephedrine, it is an alpha-adrenergic agonist. How it will act? It will act on the adrenergic receptors, where in the blood vessels of nasal mucosa. And what will happen to this nasal mucosa? It will produce vasoconstriction. And as a result of that, it will lead to the decreased blood flow. Then finally, shrinkage of tissues in the nasal passages. And in case of cough medications, they are classified as antitussives and expectorants. Antitussives are nothing but it acts directly in the CNS sites to regulate this reflex. Example, dextromethorphan and codeine. Expectorant, these thin bronchial secretions that makes coughing more productive. Example, guaifenesin.